before I was introduced to the intact vascular tack system and the TOPA trial results, as a vascular surgeon, I did not think that dissection existed that commonly. And I also was not as aggressive as I could be with balloon angioplasty because in the back of my head, I do not want to leave a stent behind as much as possible. So you generally have these two principles in vascular disease management. You want to treat all disease that's there, but you also want to leave the least amount of hardware behind. And how do you reconcile these two to provide the patient with the best outcome possible? And that's, I feel that, or my thoughts are, that's where the tack system provides the answer. It's that link, treat all disease, and you're not leaving a large footprint of metal behind that would burn your bridges down the future for an open bypass.